Hi, I'm Femi OK, and you're watching the stream. On this episode, we are talking about South Africa's third COVID wave sweeping the country, and this week, protests and riots are too. An additional challenge for medical staff already under pressure, trying to tackle the highly infectious Delta variant.
We intended to open on Friday, the 24th of June, and when we saw the situation in the hospitals and how full things were getting, we were forced to open on the Thursday, the night before. Ever since then, it's been one bed gets cleared and the next patient comes in. We try and prioritize resources, and we try and ensure, even our turnaround, once a patient is discharged, the way the room gets cleaned and gets prepped for the next patient is done within an hour. But that's because it's just such a dire need for beds and for treatment and oxygen.
Joining the show today to talk about the COVID crisis in South Africa, Dr. LINDA-GAIL, Dr. Jacob, Dr. Owen. Doctors, it's great to have you. I wish it was under better circumstances. Dr. LINDA-GAIL, welcome back to the stream. Please tell our audience and remind them who you are and what you do.
Thanks, Femi. I'm the director of the DESMOND TUTU HIV Centre. I'm a clinical trialist researcher based here in South Africa, most recently involved in quite a lot of the COVID vaccine research.
Good to have you. Dr. Jacob, introduce yourself to the stream audience.
Yes, I'm a family practitioner treating a lot of COVID patients on the front line. I'm also a volunteer medical director for Gift of the Givers, doing lots of support work for COVID patients and networking with other NGOs. And I've done some vaccine trial work for a private vaccine trial center.
Thanks for being with us. And Dr. Owen, welcome to the stream. Please introduce yourself to our international viewers.
Yes, I'm Dr. Owen Kalua. I'm the WHO representative to South Africa, and my work mostly revolves around supporting the government efforts in public health in general, but this time particularly focusing on COVID-19 response.
So viewers, you know, when we have three doctors on the stream, we can only be talking about COVID-19. They are here at your disposal. They are ready to answer your questions about the Delta variant, about COVID-19, about second waves, third waves, whatever you want to know, they will answer it right here. Put your questions right here in the comment section and be part of today's show. Dr. Jacob, let me start with you first of all. This third wave for South Africa, you are dealing with it. You're on the front lines. Can you give us an example of what your days are like?
Well, the days are not the day. It's actually the day and the night, if you really think about it. So you try and squeeze in a bit of sleep at the end of your shift. I am in private practice, but as I've mentioned, I'm part of some various doctor COVID groups, which we set up in the first wave. So the day is a long day. You don't know who you're going to encounter in your practice and how many COVID patients will be coming. We see patients from various spectrums of the economy, so those that can afford a COVID test, those that cannot. And I want to put the context into that, because most of the patients, and there's a term that's bandied around, PUI, which is a patient under investigation who meets certain criteria as a suspected positive COVID case, but they need to be tested. So those that can afford some private facility to test themselves, those are the ones that will present with the symptoms. We will test them, it'll be easy. But the challenges for those patients that I see in some of my clinics is the ones that cannot afford the test and are hesitant and need to go to a government facility. Some of them will go there, some are reluctant because of the queues and the fact that if they're not positive, they feel they may get infected in crowded queues. So that's how it starts. We investigate them. You'll get the results coming. They have to go home and isolate until the results come back. We have to check the size of the family. We have to get a more comprehensive assessment of the patient than you would normally do. When the results come back, we have to be quite vigilant as to who's positive, who could have been a false positive or a false negative rather, who may need to be seen again. Those that are positive, then there's a whole protocol of management, which then actually takes quite a different course. Some will have mild disease, others will have moderate, others will have severe, and you've got to do your inflammatory markers, monitor them, get their oxygen levels monitored and sent to you every day. So we have a group of doctors in my clinic, so we monitor them.
I'm hearing the importance of the detail of treatment, but is everyone getting this kind of treatment, Dr. Jacob?
No.
Because you've got a private practice. This sounds to me like rich people's treatment.
Oh, no. So basically, that's why I tried to differentiate. That's why I mentioned those that go to the state clinic.
Right.
They will not get that kind of private treatment. So they will go to the state clinic. But we, in our group, we will try and follow them up as much as possible. So we have protocols in place for them. You call me back when you get sick, the minute you deteriorate symptomatically, or we'll call you on day 7, or you call us back. We will decide whether we can get you into a government facility. So I was getting to that point. When they're starting to turn worse, when the danger signs are coming up in the second week, which we call a cytokine storm, that's the danger when you see, okay, will I find a bed for them? Can they be managed at home? The richer patient that you spoke about, yes, we can manage to some degree, as you had interviewed somebody in the NGO sector that I know there. They've set up some facilities so that to take the burden off the hospitals.
Okay.
But your poor patient, the majority of them, I think we're missing them. They're not getting that access. And while I'm near a bigger metro center like Johannesburg and Gauteng, there are those that are out in the rural areas. They have very little access. So we don't know how many we're missing that we're not testing. We don't know how many that are tested that are positive or not getting the follow-up care. And so we don't know how many we're losing. And so we don't really have a clue of the actual spectrum of the damage that this virus is causing. We have statistics, we have the figures that are coming through.
Dr. Jacob, let me share the conversation with Dr. LINDA-GAIL, if I may. I will come back to you. Dr. LINDA-GAIL, this Delta variant, we were ready for, we knew, let's say, let me rephrase this, we knew there would be variants, but was South Africa ready for the Delta variant? What's the damage that's being done right now?
Yeah. So, Femi, I think the beta variant, which of course was famously thought to have come out of South Africa, that caught us quite by storm. I think particularly because there was a recognition that this was far more transmissible and spread so quickly and really contributed to an extraordinary second wave. Now, we did know there was this Delta variant occurring in other countries, in particular India. We saw the devastation in India. In many respects, I guess we knew it was just a matter of time. And so mid-April, we started to feel like there was a change in the epidemic. There was just a sense that the disease looked slightly different. Many people were getting infected. We recognized the third wave was coming, and of course, that was the Delta wave. Yes.
I'm going to bring in here an additional voice, doctors. We have so many doctors on this show. Dr. Shabir Mahdi talked to us a little bit earlier and about the preparedness of South Africa for multiple waves. This is what he told us earlier. Have a listen, have a look.
Unfortunately, contributing to the high number of cases as well as a high death rate being experienced in the country is a consequence of South Africa having lagged behind when it comes to the rollout of COVID-19 vaccines, and particularly to high-risk individuals. As of today, just over 50% of people above the age of 60 have been vaccinated, but in the overall population, less than 7% of individuals have received at least a single dose of vaccine. In addition to which, poor planning with regard to ensuring that our healthcare facilities were adequately equipped for a resurgence of this magnitude has resulted in a number of healthcare facilities being completely overwhelmed, and there being inadequate number of staff in many centers to ensure adequate care of individuals that are being admitted with COVID-19.
Dr. Owen, that Dr. Mahdi said and talked about being overwhelmed. As the representative of the WHO in South Africa, you are there to help support the Health Ministry of South Africa. Why would another doctor say that the health system was being overwhelmed? Are you seeing that too?
Yes. First of all, let me say that indeed the Delta variant is really spreading quite a lot, and it has become the dominant variant that is driving the third wave. But we have got provincial differences. The biggest upsurge with the Delta variant, of course, is in Gauteng. The other provinces are also increasing, but at a slower rate. They have not reached yet the state where Gauteng has reached. Indeed, in Gauteng, there has been the health system has been overwhelmed in terms of the number of patients requiring care. this situation was mostly, of course, with the Delta variant coming in, which is highly transmissible, this situation is as a result of that. But just to comment on the issue of the vaccines as well, yes, there's been a delay in terms of the rollout of the vaccine. Unfortunately, a few challenges with the Beta variant earlier on, when some of the local studies had indicated that the AstraZeneca was not as protective, or efficacious against the Beta variant.
Yeah.
And
so
it
didn't really work, Dr. Owen, did it? It was the AstraZeneca vaccines didn't really work on the variant of COVID that South Africans were experiencing at that time. So that put South Africa back. That was a blow. Dr. LINDA-GAIL, go ahead.
Yep.
Yeah, definitely. I think, Femi, we took that blow on the chin. We had, 1 million vaccines ready to go, particularly for our frontline healthcare workers, and suddenly had data to show that this was not as effective against the Beta variant. And so at that point, we took the decision to roll out J&J single dose, which we did have some data on for healthcare workers. But we have been on the back foot for acquisition of COVID-19 vaccines. And we should have been in a better position before the third wave. We knew it was coming. And unfortunately, we're behind in terms of vaccinating. Shabir said, Dr. Mahdi said, less than 7%. I think it's around 3-point-something percent of the population has been vaccinated so far. So we have a long way to go.
A really long way to go. Dr. Jacob, I'm going to put this thought to you from YouTube, if I may. On YouTube, our audience watching right now are wondering, as they're watching on Al Jazeera the news of riots, protests, they're wondering if those gatherings, are they going to be super spreaders, Dr. Jacob? Your thoughts?
Yes, most definitely there will be super spreaders. I mean, we've had super spreader events before in our country, and this is like as somebody has put it on social media, that the virus must be smiling at these events because he's got a rife opportunity and doesn't have to do much work. So this is just aiding. So besides the comments made by my respected colleagues, these are rife opportunities for the virus to spread. And coming back to the point that other mutations will most definitely occur if we do not continue or rather do our best to try and curb these kind of things, because mutations can take place in many scenarios. And with the vaccine rollout so far behind, there'll be more mutations as more than vaccines that can cope with it. So we're like in a melting pot here. We don't know. And
it's a perfect storm, isn't it? What's your scenario?
Yes.
Sorry, Dr. Jacob, go ahead.
Correct. Yeah. Correct. Yeah. And the scenario I painted earlier is to a doctor's day's work, what are the hospital days and what the healthcare workers are going through on a daily basis. And now some of the healthcare workers have been looted and rioted. So there's less health facilities, less medicines and logistics, transport as it's getting to.
I would like to show that. I would like to show that, Dr. Jacob, and you very kindly took video. You didn't take it for us, but you took video of what happened.
No, I didn't take it for you.
Yeah,
sure.
And you probably took it for the insurance company. But you took...
No, it wasn't for me. It wasn't for me. It was from a colleague that was sent to us.
Let's use this video. Let's use this video. Yeah. Tell us what we're seeing. We're going to play the video right now because we're talking about the riots and the protests. We're talking about this Delta variant, highly infectious. Let's play the video. We'll show it, and then talk us through what are we seeing, Dr. Jacob?
I can't see the video.
Well, you sent it to us, so it's the one where I'll tell you what I'm seeing. I'm seeing moving around. I'm seeing empty drawers, things on the floor. Tell us what happened. It's your office. You know what happened. You don't need to see the video.
Yeah, like I said, it's not my office. It's my colleagues. So that's what happened to them. This was a practice in KwaZulu-Natal. And this is exactly what's happening. They were getting looted. They broke in the middle of the night. And that's the scenario that took place there. That things came through, they broke through. The next morning, the doctor was given the information in a no-go area, couldn't visit there, was given pictures by the staff that went there and to see it had been completely ransacked.
So, Femi, we're seeing this happening all around the country, particularly as Jacob has said in the KwaZulu and Gauteng areas, where distressingly clinical facilities are being looted, and this is obviously the very worst thing that could happen at this time. And vaccine centres have had to close down, which of course is the worst scenario for where we are in terms of the COVID-19 third wave.
So just to come in, Femi, indeed this has brought us very much back in terms of the response to COVID. But just to add on, it's also affected other essential healthcare services because that's affected even those that have to take up their refills for diseases like HIV, like TB. So the essential services of healthcare services that are supposed to be provided have also been affected. And then in addition to that, the livelihoods of the people in those areas will also be affected. So not only is it putting people at risk in terms of COVID, in terms of being super spreaders, but also in terms of the very ability to be able to take care of people. And if you increase even their vulnerability in terms of them not being able to have a job or a place to work, this even makes the impact of COVID much harder on the affected communities.
President Cyril Ramaphosa spoke about the impact, like you three doctors are, of the impact on trying to tackle the Delta variant right now in South Africa, and what the rioters and the protesters, the impact that they're having on that aim. This is him from just a day or two ago. This is the President Ramaphosa.
Our sick cannot get medication from pharmacies. Food does not reach supermarket shelves, and health workers cannot go to work. Our vaccination program has been severely disrupted just as it is gaining momentum.
I want to show this tweet that was sent to us from Unathi Kwaza, and she talks about the draconian lockdown regulations exacerbated a crisis South Africa's been grappling with for years. The rate of unemployment has been the cause of anti-investment and race-based policies that this government is determined to embrace. There's a political angle there to her tweet, but what people are saying when I've been watching those interviews of rioters and protesters on the streets is that they are poor, and they have had enough. And then there's COVID-19 as well. They can't work, their businesses have been impacted, their livelihoods have been impacted. It's just layer upon layer upon layer of disaster. Dr. LINDA-GAIL.
Yeah, I think, Femi, you're right. I have the sense that we're sitting on a powder keg, and there's no doubt that the country is, as we say in South Africa here, gat vol, which means, we've kind of had enough. And unfortunately, whilst we have on the one hand a health system that's overwhelmed and the government doing what they can to try and contain through NPIs, the restrictions, the lockdowns, etc., this is just fueling that sense of lack of control, lack of ability to have an impact on their own destinies. And I think this is what's resulting in people feeling out of control and adding to the anarchy that we're seeing at the moment.
If we go back to the health crisis, there is a way out of this, and it's vaccines. It's like, how fast can you get South Africans vaccinated? This is Vicky. She is a researcher, and she spoke to us a little bit earlier about vaccines and rolling out the vaccines and where South Africa is right now. Have a listen, have a look.
I think there is definitely some vaccine hesitancy in South Africa. However, now that we have the vaccine here, I think it is definitely reduced. So I think right now our limiting factor is the stock availability, but also our infrastructure that's available to actually go out and vaccinate people. So the more sites we have, the more vaccines we're seeing daily. However, currently, unfortunately, with the riots that are happening in South Africa at the moment, that has really reduced the number of vaccine sites available all the way down, which we've seen massive reductions in the number of vaccinated every day.
Dr. Jacob, what difference could this make to your patient care?
Look, it'll make a huge difference because obviously vaccine is the cornerstone to try and control this pandemic. But just to comment on that video there, we've had colleagues who have applied to be vaccine centers to meet the requirements. And surely far more vaccine centers can be set up. And there are a number of doctor groupings and IPAs, which is independent practitioner organizations, who are willing to become vaccine centers. But the sheer regulations and rules to set up these vaccine centers are prohibitive. A lot of us have been involved in clinical trials before. We've given vaccines for years in our practices, childhood vaccines and ongoing travel vaccines. But again, there's just too much bureaucracy in our country. And even the previous argument about layer upon layer, you can understand it. We just don't help ourselves. We just make things a lot more difficult. And I think things should be loosened up. There should be a lot more collaboration between private and public so that we can really get this thing going much faster. And everybody's keen. I mean, from the first day from COVID wave number 1, March 26 last year, the healthcare workers have been at the forefront, not only in terms of working in their private practices, but they're willing to give all the time. But this just hasn't been enough coming back from, and the bureaucracy has just been too prohibitive.
Dr. Owen, you have the ear of the Health Ministry. Can you cut down the bureaucracy?
Well, yeah. I know that...
That smile will be a no, Dr. Owen. Dr. Owen, shifting uncomfortably in his seat, no, that is not possible.
No, I know that the Department of Health is working quite a lot towards speeding up the whole process.
What does that mean? How fast?
Let me elaborate.
Okay.
Looking first of all at ensuring that there are adequate vaccines to be able to be rolled out. Secondly, looking at the ensuring that they build the demand to be able to speed up, even to get people vaccinated. That's why they're even opening up nowadays that people who can even walk in, who have been registered to walk in to get their vaccinations, but also trying to build the system to increase sites for vaccinations so that more vaccine could be provided. At the moment, already they have opened up the vaccination to those who are, at least to the registration to those who are 35 to 49, having already started the 50 and above. So yes, the process should be faster because we'll have much better impact if we do speed up the vaccination. Maybe for this particular wave, we might not experience the benefit of having rolled out the vaccine, but we know waves will come, new variants will probably emerge,
Dr. Owen,
that maybe there'll be a fourth wave, so we really
there will be a fourth wave.
Make sure we do.
Yeah, is there anything I've learned from all of you magnificent doctors that have been on the stream over the past 16 months is there will be another wave. I want to ask you right now, and it's a yes or a no or one comment question. Dr. Owen, how optimistic are you right now about vaccines being rolled out across South Africa? One word.
I'm reasonably optimistic. If we do have the vaccine supplies.
If. Dr. Jacob, you're on the front lines. How optimistic are you right now?
I'm not optimistic because it's not the only if that Dr. Owen, with due respect, is talking about. Historically and now, the process is just too slow and I can't see anything working at this rate. I'm not optimistic at all.
I appreciate your candor. Dr. LINDA-GAIL.
We need vaccines. So that's the main constraint. We need these vaccines to come into country. And, you know, that's really the biggest ask.
Yeah. Doctors, thank you so much. Dr. LINDA-GAIL, Dr. Jacob, Dr. Owen, I appreciate you being on the stream today and sharing your expertise about the COVID-19 Delta variant in South Africa and the impact that it's having. Thanks for watching, everybody. See you next time.